All right, why don't we go ahead and get started? Welcome, everyone, to today's Berkeley Insights. Today we have Christopher Doran, and he is going to be talking about brain-based learning theory and implementation. So I'll pass it to you, Christopher. Thank you.
Hey everybody, thanks for coming. My name is Chris. I'm one of the nursing professors here at Berkeley College. Um, just a little bit about myself. I have been a nurse for a while now. I decided to go into nursing education because I loved training all the new nurses when they came to the hospital. So I said, let me get a master's in this. So a nursing educator has half their coursework in graduate school is advanced practice nursing. And then the other half of the coursework is actually learning theory and curriculum development. So I was passionate about both. So I was grateful that there's a degree in that. And I'm currently in the process of finishing my doctorate this semester. Thank God. It's finally, I see the light at the end of the tunnel. So I'm excited to be here. If you want to learn more about me, or you want to listen to any of the talks I've done, or interviews I've done on brain-based learning theory, particularly in the healthcare setting, just let me know. I can send you those recordings. So I'm excited to be here. And part of this training and discussion is going to be also focused on Gen Z. So we'll tie that in here as well. So one of my favorite quotes is the mind is not a vessel to be filled, but a fire to be kindled. And I think that speaks to all of us that we have this innate ability to learn and to retain information. We just have to be the educators that feed that fire with oxygen and wood. And we'll talk about what the oxygen and wood are to feed that fire. Um, so brain-based learning theory is really cool. Most of my nursing experience to this day revolves around geriatrics and neurocognitive disorders. So the brain is just something I've always been fascinated with. And so in grad school, I wanted to dive into this learning theory, which is called brain-based learning theory. And so we're going to talk about how the brain learns, retains information, and that's really important in education. And what's really cool about this theory is that they actually used neuroimaging to determine if the effectiveness of their learning implementation worked. So one of the things about brain-based learning theory is understanding that brain-based learning theory is looking at the brain and how the brain itself retains information and learns information. The other thing too is when we understand how the brain works, we can understand how students process information. And by understanding how students process information, we hopefully can get them to have more streamlined processing thoughts, but also having more, um, I guess, having a functional classroom where the classroom is engaging students so that they have more effective time processing information that they're receiving. And the nice thing about brain-based learning theory, as I said, it's founded in neuroscience. So some of the core principles of brain-based learning theory is emotions matter. And so one of the things as a millennial that I think drove me crazy when I started in nursing education was I felt like a lot of the colleges were doing these safe space um, rooms. And I was like, what is this safe space thing? This never existed before. And I'm not advocating for safe spaces, so to speak, but what I am advocating for is allowing for safe risk taking. And so what that means is that we allow a classroom that allows students to be able to express emotion about the learning material, about how they're processing the information, and if they're struggling with the information. So students should feel comfortable with their instructors to say, hey, I'm really frustrated with this content, or I'm really scared about this content. And emotions matter. And when we engage students and make them feel emotionally safe in the classroom, so it's not protecting them from emotion, but it's letting them express their emotion without repercussions, it actually produces more, it enhances learning outcomes. We also know that brain development is super important. And the prefrontal cortex, which is right about here, it's right behind the front of your head, kind of towards the front. Um, that prefrontal cortex is responsible for judgment and decision making, and it's not fully developed in women until about 20 and in men in about 27 years old. So that's why I always joke with my students. I say, when you were probably in high school, if you're female, you probably were attracted to older guys in the school, and that's because their brains were more developed and equal to yours. So men, their brain develops a lot slower than women. And one of the most interesting research that came out of brain-based learning theory was active learning is the best type of learning. So lecture is actually one of the most ineffective ways to learn. What they say is about 15 to 20 minutes of lecture, and then the information is gone. So what we try to do in brain-based learning theory is lecture on core content and then have the students break out into groups or have conversation or storytelling, and we'll talk about that more in a few minutes. And then contextual learning is applying to real life scenarios. I think Berkeley College does a really beautiful job. I kind of am very active on LinkedIn, so I see the marketing team like going crazy with someone was on like a talk show the other day, and then I see them involved in like fashion merchandising events, and I'm like, this is like the coolest thing ever. So getting students involved in real life application is going to help them actually retain information and apply it to real life scenarios. The other thing too is as adult learners, we do care about grades. I shouldn't say we don't, but we really care about, is this going to help me in my profession? If it's not going to help me in any way, shape, or form, I don't want to know it. And so we have to keep that in mind with our students as well because they are adults. And collaborative learning. So the best learning takes place when students teach each other, having those study groups, and even having something called teach back or flipped classroom, where the students are actually teaching each other, has been proven to be very effective for brain-based learning theory. Um, so we're going to talk about the emotional parts of the brain, which is our limbic system. Our limbic system is highly important for emotional processing and emotional regulation. And so understanding that our brain is an emotional brain really helps us understand that the classroom does have to have emotional vulnerability. Brene Brown, who's like um, my favorite. She's actually a social worker and a researcher, but some of you may know her from her books. She talks about emotional vulnerability, and she has a great lecture on emotional vulnerability in the classroom. And so, again, just really allowing students to express those emotions, also allowing students to express joy and happiness and excitement about something is also something we want to pay attention to. Celebrating successes are something I think about as well. So, a few things about something called cognitive load. So, cognitive load theory with brain-based learning theory talks about over information, and I am so guilty of this. And there's something we call need to know, nice to know, and niche to know. Need to know, again, is what do I need to know to be successful? Nice to know is, okay, is this going to help me in any way? I may not need it, but it will be good to know in the future. Niche to know is very, very specific information that really only a select few people, if they went into a specific specialty, would need to know. So in nursing, I think about when we talk about psychiatric nursing, you need to know that SSRIs and St. John's wort combined together can cause serotonin syndrome, which is deadly. It's nice to know that St. John's wort is in other supplements, and sometimes it's hidden, so it's important to read the labels. And then when we talk about niche to know, there are a couple of amino acids like L-theanine and NAC that help with certain symptoms that SSRIs are used to treat. So we can really focus our learning and teaching methods on knowing what's need to know information and taking out all that niche to know. There is such a thing as learning preferences. So students do have learning preferences. So just keep that in mind. We do ask students to be mindful of what their learning preferences are. For me, I'm very auditory. So the way I study is I just listen to things over and over again. Some students need visual charts, and it's possible to need multiple things. So it doesn't necessarily mean you only have one. So when we talk about that flipped classroom I was talking about previously, it's important to have diverse instructional methods. So don't have a classroom that's just straight lecture. And I know it's difficult because I feel like we have to cover so much information in such a short period of time. But diverse instructional methods is lecturing on that need to know information that students are not going to get from their textbook or are not going to necessarily get from supplemental learning tools, and then allowing them to possibly do group work or other activities to enhance their learning. Students need brain breaks. And you and I, we need brain breaks as well. And so a brain break doesn't necessarily mean allowing the students to go, to the cafeteria, even though that's very helpful. But brain breaks could just be, all right, let's take a break from this and talk about something we did this weekend. Or it's just really taking a break from the material that's being covered. And it's really important to do formative assessments. Uh, there was a really interesting statistic that came out for New Jersey about children. And what they're finding is a lot of children are not proficient in reading and math. It's a very high statistic number, but they're still passing the course. And so the question that I had for myself is my exams that I give students, is it going to show that they are prepared to be good nurses, or am I just giving them stuff that's too easy to allow them to pass? So formative assessments is really to help us understand what's wrong. And when I say what's wrong, it's really doing good item analysis and looking at the questions we're asking students. And we talk about something, if you go to Canvas and you do the item analysis, you'll see something called a discrimination index. A discrimination index is very similar to something called a point by serial score, but it's a statistical measure of how the top performers did on that question and the bottom performers did on that question. And if the top performers got the question right and the bottom performers got the question wrong, that is a really good question statistically. But if the top performers got it wrong, and the bottom performers got it right, it's technically a bad question. And if everybody got it wrong, it's potentially a bad question. And that discrimination index in Canvas really helps you understand if the questions that you asked on an exam are actually effective questions at evaluating what students have learned. We could talk about statistics for hours, and I don't want to overcomplicate it, but it's really important that we do some self-examination about the questions we're asking on formative assessments. Um, Something I think about too in the classroom is a culture of respect. I know it sounds silly, but if we expect something of our students, we should be doing it as well. So if we want our students to be on time, we should be on time. If we want our students to submit assignments on time, we should be grading assignments on time. So I think those are things that is hard because we all have lives and families, and some of us I know, actually a lot of us I think are still in school for different degrees and certifications, but it's really important that we give that respect. Classroom space design. So there's really interesting research about how you arrange the classroom. One of my favorite courses when I was in school was industrial organizational psychology, which talked about space design in the workplace. But in the classroom, space design is really important as well. And so one of the things we like to do is put the desks together. A lot of the classrooms have the desks on wheels, so you can actually move them around and have the students collaborate with each other. Um, One of the things I think is hard about the classroom is the lighting. So we do know that a calming environment can help students learn better. Integrative technology in education is really important. So we talk about using artificial intelligence, which I'll dive into in a few minutes, but also another program, which is I'm also going to show you, which is free to all Berkeley College faculty, which is really exciting to help engage technology in education. So how do we overcome barriers in learning? So many of us are resistant to change. I am resistant to change. I'd be lying if I said I wasn't. I am someone who likes routine. I like knowing what's happening. I like to know what I need everything. I need to be in control. I don't drink alcohol because I like to have like a prediction of what's to come. And so even if I have like I should correct myself. I'll drink like a glass of wine, but I don't drink at all to get drunk. I don't like the feeling of being drunk the one time I was, and that's because I don't like change and I don't like not being in control of my environment. So, resistance to change is something we have to be mindful of, that change is okay. And sometimes we have to adapt with the times, but bring along those old school values with you as you're adapting, because those have meaning and value as well. Another issue that we may run into is limited resources. Some of our students do come from um, certain economic situations. I've been really impressed with this college. I did work at a university before this, and I feel like this college does a lot to help their students financially. So just helping the students connect with those resources is really helpful. Um, Another thing that we see as a barrier is lack of training. A lot of educators have not had education courses, so they're coming in from their specialty. So getting some good training on brain-based learning theory or other learning theories is very helpful. Collaboration is super important. I like that we do faculty development meetings every semester. That's an example of collaboration. Or just, I feel like the our offices are like in a WeWork space, so that's really nice too because I can talk to other faculty members about certain issues I'm having in the classroom. So I kind of talked about the assessment process, so I'll just skip this slide. With any classroom, we like to do something called Socrative questioning, which is a teaching method where we ask open-ended questions to get students to critically think. So and I could send this PowerPoint to you guys if you want to go through it, but these are just some Socrative questions I found. Just, I call it like the detective or Sherlock Holmes questions, like what makes you say that, playing devil's advocate. Students, when we talk in community health, they always want to know what my political affiliation is because they can never figure it out because I'm always playing devil's advocate for no matter what they say. And I love playing devil's advocate. So, um, they can't tell where I stand on certain issues, and I like that because it makes them first view me as someone who is non-biased. So again, it's creating that safe environment. You know, I always think about how we have students who have different views, different opinions, different political affiliations, and I don't want to alienate anyone. But I also want them to think about their position and put their foot in the other side's shoes when we talk about complex topics that pertain to health equity and certain government policies that affect health outcomes. So the brain loves connection. We are fueled by connection. Our neurons connect based on what we do. And this is how we form habits. And so a habit is formed when we keep doing something, the neurons connect to cause that habit to become routine. And so one of the neurotransmitters that we talk about with connection is dopamine. Dopamine is a reward neurotransmitter. Dopamine is released when you get a like on Facebook or TikTok or Instagram. I joke that when I post something on Instagram or LinkedIn and it doesn't get a lot of likes, I'll delete it and then repost it to get that rush of dopamine. But that is why technology can be addicting. That is why alcohol, drugs, love can be addicting because of that dopamine. There are groups for love addiction, fantasy addiction. I mean, these are all dopamine receptors being overly triggered. And so to break a habit, there's certain things we have to do, and I'll talk about that in a second. We have something called mirror neurons. So the neuron learns based on what it sees. And so, as I said, as instructors, we should be modeling what we want our students to be because they see who we are, and that modeling behavior is going to impact who they become. I think about some of the best professors I had, and I wanted to be them. I wanted to know the knowledge they had. I wanted to be able to, in particular in nursing, just look at my patient and be able to do what my professor was doing because I thought it was so cool that my professor was able to touch somebody and know what was wrong with them without looking at labs. I thought that was like fascinating. So I wanted to be her. Um, so how do we apply the mirror neuron and get it to make connections in the classroom? Well, incorporating visual demonstrations and peer observation of each other, and also observation of the professor. Students who learn with visual aids and interaction perform better. So getting students to actually use their hands and engage. I like, especially with our college, I feel like a lot of our majors are focused on like doing things. When I think about graphic design or I think about fashion or our health studies programs, it's all about doing things, which is really cool. When we talk about legal studies, think about things that they can do that's hands-on. Maybe it's some type of document preparation, or maybe it's creating some type of presentation on the topic that they're learning. Some interesting studies came out that students should be able to reflect on their learning. So there is something called an e-portfolio. I teach capstone in nursing, and one of the things I have the students do at the end is actually do a reflective assignment to reflect on their whole degree, because it shows that it allows them to pull their information together. And then that e-portfolio is actually an electronic folder that students can create. They carry it with them on their computers over the course of their degree. And they can always go back and look at their weaknesses and then expand on those weaknesses to make them strengths. So some of these things I talked about already, so I'm just moving through those. Artificial intelligence. Artificial intelligence is something I was definitely scared of when it first came out, but then I realized it should be used um, to support our learning outcomes. And so one of the things we can do is actually have students use artificial intelligence to determine what's wrong. And what do I mean by that? I mean, artificial intelligence is not always correct. And so sometimes what I'll have students do is take artificial intelligence and make a study guide based on a topic that they're learning in the nursing class. And then I'll say to them, all right, what is not correct in this study guide? And I'll tell you that there's usually two or three things that aren't exactly accurate. And it's really cool to see the students say, oh, you know what? These two things shouldn't be combined together. They should be separated. And I'm like, yeah, that's correct. So it's getting them to critically think and point out what's wrong, which shows that they've actually retained information and are applying the information. So to break bad habits, we think about like getting bored or studying. Um, Instead of when I have a trigger for something that's going to first you have to identify the trigger of what's causing the bad habit. And then instead of making the bad habit the drugs or the drinking or the scrolling through Instagram or Facebook, it's diverting the activity to something else. And so this example talks about just closing your eyes and listening to an audiobook. But when we work with people who have addictions, it's calling their sponsor. So rewiring the brain to when I'm triggered to do something. So whether it's stress, anxiety, something happened that's not in my control, instead of me going to my vice, I am now going to do something productive. All right, Gen Z. Gen Z um, has been an interesting challenge for me just because I do now. I didn't understand them. I was getting frustrated when they wanted stuff right away. They wanted the answers right away. They wanted to constantly talk. I felt like, again, I'm a millennial, but I felt like when I was in college, we would talk sometimes, but I felt like there wasn't that constant like talking interruption in the classroom. And this was an issue, I'm not saying this is an issue at Berkeley. This is an issue with everyone I talk to who teaches Gen Z. And so, who are they? They're born after 1996. So they graduated high school in 2019. It's a very diverse generation, just based on first generation families that have come to the US. And these students are very, very reliant on technology for their day-to-day functioning, homework, studying plans. They use ChatGPT constantly to help them study. And the things we have to keep in mind with Gen Z is that they are social. So they need that conversation. They were brought up on a digital age where everything was social. And so we want to play into that again by encouraging group work and collaboration because they are constantly on their phones, I'm going to show you a program you can use that's free to Berkeley College to get them using their phone for the classroom as opposed to using social media. Gen Z likes interaction, so keeping them interacted in the classroom, again, not just straight lecture. And Gen Z is very cautious with their spending. So play into that, especially if they're anyone in the finance realm, just knowing that they actually may be good with their finances better than the millennials, based on their cautious approach to finances. Gen Z loves mobile learning. They love micro learning. So what that means is they should be able to take their cell phone and learn on the go. So I don't know if I was a multimillionaire, I would love to create some type of like app with like practice questions or an app with like little reading segments that they can do every few hours just to get information. But I'm not a multimillionaire. I don't know how to do that. If anyone knows how to do that, let me know. Some interesting stuff. They are looking at virtual reality, particularly in nursing education. Um, and I think that's like really cool. I could talk about it for a long time, but basically they create a virtual world where students like display their work and you could go into this virtual world. It's not up and running yet, but it's something that may come along the pipeline in the future. So we talked about this Gen Z and this is part of brain-based learning. They love that peer learning, learning from each other, from community. They like bite-sized information. Brain-based learning theory supports that, saying that lecture should only be 15 minutes and make things engaging. And Gen Z loves instant feedback. So what this means for me as an instructor is they want, when they talk about instant feedback, yeah, they want their grade right away, but they want to know what they did wrong. How cool is that they actually want to know what they did wrong instead of being like, oh, I'll deal with it later. They want to know right now, where am I messing up? And so what I do with students is I will go over exams with them with rationales once everyone has taken the exam. I try not to use the same questions the next semester. Sometimes they may repeat, but it's not the whole exam. So I feel comfortable sharing the questions. I use a lot of my own questions. And we go over the rationales, and they feel satisfied with that because they actually feel like, oh, okay, I learned where I made my mistake. I'm not going to make it again. Instant feedback also means if a student messes up in the classroom that you correct it right away. And I kind of like that. I thought that was a cool trait that they have. Okay, in Canvas, you all have access to something called Lucid Spark. And so if you go into Canvas, right on the left-hand side, it says Lucid Whiteboard. Lucid has um, a training program. You could see it there. It says Training Lab Lucid for Education 101. It tells you how to use this program. It is a really cool program. I started using it this semester. I used to use a program called Miro, and then I saw Berkeley had this program, so I started using it. And basically, it is a interactive concept map that students log into their computers or phones, and they're able to type in to the Lucid board. So we were doing, this is actually from my class, we were doing sickle cell anemia. The students, I broke them up into groups. I had one person type and everyone else was talking. I did put prompts in before the class started about sickle cell anemia. Everyone had their own colors, so they knew what color to type into. And as they were typing, I was at the computer interacting with them. So while they were typing, I would, in their color, ask them a question. So one of them, if you look at the bottom here, it says instant ice. Sickle cell anemia, you don't apply ice during sickle cell crisis. So one of the questions I asked them when they were talking about nursing intervention is, should I apply ice because I'm in pain? And I put a picture of ice next to their post-it. And the students told me they really liked this program. They thought it was really cool how it worked. The other thing about this program too is you can upload your PowerPoints into it so students can actually type into the PowerPoint. So I thought that was kind of cool too. So I'm learning this program as well. I'm not claiming to be an expert, but I did want to show you that this is something I think we could all definitely kind of explore and teach each other as we go through it. Um, so this is just another example. And so, as educators, remember that safe learning environment is we're leading that safe learning environment. We should encourage risk taking that is safe, and we should be focusing on collaboration. And that is pretty much it for me.
Wow, amazing. Very interesting, Christopher. Thank you. Does anyone have any questions? Okay. Yes, if you could send me the PowerPoint and I'll post it to the
Yeah.
Berkeley Insights site as well. That was really good, easy to digest. I'm sure many of us need a brain break right now,
Yeah.
but but thank you so much.
That's
Uh, all right. Christopher, do you want to share, like, would you feel comfortable sharing your dissertation? Does it have anything to do with this?
it doesn't, but
Okay, all right.
I love talking about my research. So right now I'm looking at spiritual health interventions for nursing outcomes. I'm using a tool called the Facet SP12, and basically what the research has showed is that nurses in particular don't feel comfortable and don't have awareness about spiritual health assessment and interventions. And all the research from other countries, the US doesn't participate as much in this research, shows that spiritual health improves pain, it helps with patient satisfaction scores. It helps with depression, suicide, addiction. Um, so those were all things that were really fascinating to me. So right now I have a medical practice that is implementing this Facet SP12 tool over the course of the next 8 weeks, and we're going to kind of see what happens with it. So
That's
that's a
awesome.
quick
I'm
summary.
sure, yeah, I'm sure it's much more intense than that, but good luck. We'll be thinking about you, and it sounds like a very fascinating topic. So, um, oh, Ann Partridge, how would you define spiritual health?
Oh, yeah. I mean, so spiritual health, it depends what measure you're looking at. Most of the measures look at a sense of purpose, meaning, and a sense of faith. And so questions we ask patients, in particular for spiritual health is, um, do you feel that you have a sense of purpose? Do you feel that if life were to end today, that you would have accomplished everything you wanted to accomplish? Spiritual health is not just meant for people that are dying, it's meant for all of us. We all have, when we talk about nursing, we talk about holistic wellness. And so, mind, body, soul, and spirit. Spiritual health is also looking at connection to a higher power. Higher power doesn't have to be, a religious entity. It could also just be nature, compassion, because some people are agnostic or atheist. So, spiritual health is not religious. There are some studies that will use something called religiosity. So making religion and spirituality come together. Um, but spiritual health is much greater than religion because religion is mostly focused on traditions and customs, where spirituality is more focused on connection with higher power and inner peace.
Excellent, thank you. And Sunder just put a comment. Is Gen Alpha next?
Yeah, so Gen Alpha is really fascinating. Gen Alpha was home during COVID, and so they only know family, and they only know very close relationships. So what we anticipate is going to happen with Gen Alpha is the family is going to be center at their learning processes. So I think when Gen Alpha starts coming to college, that may require us to do like a lot of family events. I have a feeling that's what the students are going to want. They feel very connected to their family because that's how they were brought up. And Gen Alpha does not like technology. So they will use it, but they actually would prefer interaction because they were home and the technology was seen as a distraction and a deviation from being able to connect with their siblings and their parents.
Oh, wow. Interesting.
Yeah.
Um, okay, and then ER, taking your presentation on targeting this generation, What advice do you have for educators teaching students who are not good test takers?
Oh wow. Um, so I would first try to determine what is making it hard for them to take the test. Is it test taking anxiety? Do they have an undiagnosed learning disability? Is it that they're not reading the question correctly? So I think trying to figure out first what the issue is can actually help the student. Then we can make interventions for that particular issue. I think that question is a really good question. I think connecting them with our disability office and maybe even like the counseling office can help them. What I do notice too is that students who do need services, I'm not going to go up to a student and say you need services, but they typically are in denial about it. Um, Particularly, I have a student I think has dyslexia, but again, that's not my expertise, but she doesn't want help. I always give them all the resources. I actually have the counseling center come into all my classes at the beginning of the semester and have them talk to the students about resources. And some students go, and then some students who really need it don't. So that gets difficult.
Wow. Well, thank you so much. And very interesting. I think everybody seemed to enjoy it. So thank you so much, Christopher. Everyone, have a wonderful day.
Thanks,
Thank
everyone.
you.
Thank you, everyone. Bye-bye. Thank you.